Hello and welcome to another episode of Gender Stories. As usual, I know I always say that I'm excited, but it's because I am truly excited every time. And today I'm very excited to be with Laura Scarrone and Michael Beatty, who alongside Skye Davies have authored this wonderful book, Gender Affirming Therapy, that has been published by the Open University Press. And Skye's not with us today, but I have the privilege to talk to Laura and Michael today. And I'm just going to let you know about their wonderful work. Laura Scarrone Bonham is a consult clinical psychologist who specializes in gender, sexual, and relationship diversity. She provides assessment, psychotherapy, and training to other professionals through Affirm LGBT. And we'll talk about that wonderful online training platform that both you and Michael are involved in as we go today. And then Dr. Michael Beatty is a counseling psychologist in private practice with research interests in the psychology of men and masculinities. In addition to psychotherapy, Michael provides training in gender, sexual, and relationship diversity through the same platform, Affirm LGBT. Thank you so much for making time to be with us today.
Thank you, Alex. It's lovely to, after so many emails exchanged between us, to be able to see you and to talk to you directly. And I think that the first thing we'd like to start really is to thanking you, because you wrote the foreword for our book. And it was very, very important for us to, first of all, to get such a heartfelt piece of writing from you and such a validation from you. But also, thank you, because both Michael and myself, and I know as well Skye, have been following your career and your writing career. And it's been really inspirational to us to see how you use vulnerability as a superpower in your work. And I think that's very difficult for us sometimes as psychologists who have been taught not to self-disclose anything about ourselves, but also in such a politically heated environment, to be able to be vulnerable is very, very difficult. So you are doing an excellent modeling for the rest of us.
Thank you.
Absolutely.
I'm going to just take that in. I've been practicing. Just take it in when people give you compliments, just say thank you. You don't have to deflect or anything. So I'll just let that soak in. Well, I did really enjoy writing the foreword for your book, and I felt very grateful that you've asked me, and I definitely want to talk about the current political climate, but let's start from the book, first of all. And why did you feel this book was needed? Let's just start, people decide to write books for all sorts of reasons. And I'm always fascinated, what made you go into writing this book? Because writing a book is a project, right? A lot of people think about it. A lot of people might even start it, but it is a project to go from start to finish to publication. So, what inspired you to write the book?
So, Michael had already written an excellent, clinical guide on supporting trans and non-binary people, counseling skills for. Oh, Michael, you know the title better than I do.
It's a catchy title. It's Counseling Skills for Working with Gender Identity and Gender Diversity, I think, or the other way around.
Your publisher is not going to be happy about this.
Jessica Kingsley Publishers. Available at all good bookstores.
I need to look it up. I was like, I remember reading that book. It's been a minute. It's okay.
But I hadn't had the chance to write a book. I had done some research and some exploratory material on the relationship that trans and non-binary folk form with the mirror. And I felt from my end where it was lacking is to find something that it was a bit more personal. I think that there was a lot more clinical and dry content out there, but I wanted to find the sort of the Esther Perel or the Irving Yalom or the Susie Orbach of gender therapy, and this is not to me, bringing my ego up, but this is like the modeling of the things that I wanted to be able to find as a clinician. Both Michael and myself worked at the Gender Identity Clinic in London, and that's how we met. And, thinking about the sort of support that was available at the time, it was really just sit with this clinician and learn what you can. But many times people ask, what kind of books can I read? And I felt like there weren't that many that could encompass these elements. So after we delivered a training session for the British Psychological Society, I was approached and I was like, yeah, I know the book I would like us to write. And knowing Michael's experience and excellent ability with words, particularly as a non-native English speaker, I was like, I need him by my side. And so that's how we started putting the book together. And it was very, very important as well for us that it wasn't, or it was, as you know, not biased in a way that it wasn't just clinicians talking about the lives of trans people, but rather that it was the other way around, right? We are informed by what we learned from our clients, by what they told us. And it's almost taking those snippets of repeated narratives that you hear time and time again. It's like, oh, wow, this is really resonating with this other person and this other person. So we invited our clients, we invited Families Together London, which is an organization supporting parents of trans people. And we wanted to make it as alive and truthful as possible.
Yeah, and one of the things I really appreciate about your book is that you do have lived experiences of folks, and I love the subtitle is a guide to what transgender non-binary clients can teach us. You know, I often think that like a trans and a queer lens can be so supportive to clients of all genders and sexualities, actually, especially as a family therapist and a couple therapist. Sometimes I really see how that cisgenderism or cisnormativity really impacts people. Even like cis straight people are impacted, right, by those things, which is at the heart of gender trauma, of course, which is, you know, that's how I approach the whole topic. And so I really appreciated that subtitle, to a guide to what trans and non-binary clients can teach us. And to distill it in a book so that clinicians don't have to learn from their clients directly, right? That they have like, look, we've already done the work for you. We have learned from our clients and our training. And now you can maybe be a little bit more culturally attuned to your clients. Michael, I'm really interested in I do think that the first book you wrote and this book are different, but I'm really interested to hear like, what is different between those two books, right? Because like you said, Laura, often books for clinicians are very much, this is how you treat other people, right? Like this is how there is this kind of underlying assumption, that the people we treat are others from us and that there is this distance, right? And this book is not written in that way. So yeah, Michael, I just would love to hear more about how you feel the difference between those two.
Yeah, really interesting question. I could probably answer it in a whole bunch of different ways. I think certainly I would agree with what Laura said in terms of positionality, that certainly the way I was trained was very much like, don't self-disclose anything about yourself. And I particularly found that challenging. I mean, I didn't train that long ago. I guess I fully qualified about 10 years ago. So I started training about 15 years ago in the UK, and gender and sexuality were very much out there in the clinical population. So I wrote my thesis on gay male therapists' experience of working with men. And it was quite challenging to kind of get that work done, in part because there was never this sort of sense that that the gay and trans and so on people were therapists,
yes.
And were and I raised the question of like, why wasn't I given training on how to work with cis het people? Because when I first started working as a therapist, I was working with cis het people. I'm like, I don't really understand how these people do their relationships, and the first person I worked with was a straight woman who was divorcing her husband, and I found that really challenging because it wasn't in my kind of wheelhouse. But I'm kind of slightly going into that sort of side topic. But the core sort of idea was to say, well, actually, this is in here, and that one of the things about this particular book compared to the previous one was that Laura very much gave us all permission to very much be in the book and write about ourselves and and challenge. It was a real challenge for me to write in my chapter that I wrote something about my childhood and about my experience of having my masculinity policed. And this sort of idea that actually we all have a gender identity, and that gender is something that we share. It's very much your sort of point about gender trauma. So I sort of felt that that permission then allowed the kind of conversation to be about, okay, so what is masculinity, and how do I even define myself as male, and what does maleness mean? And I think both of us realized in that it's not a topic really that was ever discussed at the gender clinic. We might have been given training on HRT and gonadotrophin releasing hormone analog and all of this kind of technical stuff, but like, what is a man? What is a woman? What is masculinity? What is femininity? How is it performed? What does gender even mean? Was never looked at or discussed, and so we wanted to bring that into the book a lot as well.
Absolutely, and I love how you did that, and you're really speaking to my heart, Michael, because I remember even when I did my psychotherapy training in the UK over 20 years ago now. Wow, I'm getting real old. Because my first licensure was actually in the UK with the UKCP all the way back in 2006 at the end of my training. And it's easy for me to track because I had my oldest was born right, I think, in my second year of clinical training. So it's an easy remember. I was like, oh, how old is she? Oh, yeah, she's going to be 21. So over 20 years ago. There was really so little, yes, there was something about LGBTQ populations out there, but it wasn't really integrated, and I remember we had to do this paper on like observe a family, because I did systemic psychotherapy training, observe a family that's different from yours in terms of like culture and so on. And I went to observe like a English Christian family and their mealtime, as a ritual. And I wrote the paper, and I remember the tutor going, oh, that's not what I had in mind. And I was like, well, they're different from me. I was like, I'm not a Christian, I'm a practicing pagan, I'm queer, they're straight. I wasn't out as trans yet at the beginning of my clinical training, to myself even. I was just figuring it out still, just about, I'm like genderqueer, I'm bi, like they are different from me, and they're like, oh, and I'm like, yep, that says a lot. So it's this othering of anybody who's, often when we think about diversity in our field, we're thinking about people who are not cis, people who are not straight, people who are not white, right? We never think that for some of us, actually, I was like, English culture, endlessly fascinating to me, right? But I had people in my cohort that were like, you're so lucky that you have culture. We don't have any. I was like, oh, you do. Let me tell you all about your culture as an outsider. I see it. These are all the fascinating things about English culture. You know what I mean? And so I so feel that.
Yeah.
And I love that you're going through this process also of like putting yourself in the book, and I wonder, you said it was challenging. What was it like also to write this book? I mean, you're in partnership with Skye as well as a co-author, but in terms of assist folks and, assist people, assist therapists, what was it like to engage in that process of like really putting your positionality in there and putting yourself out there in this way? Does that make sense, that question?
I think, it was conflicting at times. There was a element of thinking, am I going to put too much of myself out there? Is this going to hinder my work? How am I going to feel when someone approaches me and say, hey, I read your book and I know that your family is South American, or I know that, these things about yourself. So I think there was a lot of active questioning as to how much was I comfortable to share, but also it involved a little bit of a leap of faith, in terms of being able to share it and hope that it would be received in the way it needed to be received. For me, the leap is even greater because not only am I cis, but I'm also straight, and I was also raised very Catholic, and it's like, it's the whole, the very core of, the ideology that we're trying to shape and challenge. And this is why, for me, it's been so amazing, because even though I've had lots of, LGB friends in my life, I had never met a trans person until I got the job at the clinic. And it was a matter as well of challenging as well, what was I going to do there? for a moment, I thought I needed to, I don't know, guide trans women on their expression of femininity, because as a cis person, I had that, validation, and I know how to do it. I had that, perhaps the idea of, a certain arrogance that a cis person arrives to a trans field with, or thinking that certain things might be odd. And suddenly it's like, well, why yours is more valid than mine, why your experience. So this been a whole world opening to me. And as much as I'm cishet, when I learned that queer was also an ideology, I was like, okay, I'm queer too then. I want to insert myself into this world and into this way of seeing things more flexibly and to fit people's experiences, not just the mold.
Yeah. Oh, I love that. Michael, how about you?
I was going to say, I found the process very affecting in terms of thinking about intersectionality, and the fact that as a middle-aged white man who has been privately educated, I grew up in a very colonial kind of setup. I was born in what was then Rhodesia, and which became Zimbabwe, and I lived in a kind of very white colonial upbringing with a reasonable degree of privilege. I also, like Laura, I had a very Catholic background. I, in fact, even trained to be a priest for a while as a way of kind of avoiding having a sexuality and the shame of being gay and within the context and culture that I lived in. But the process of writing, I think, just made me more and more aware of different kind of intersectional privilege and kind of oppression in different kinds of ways, or disprivilege. I don't know. I wouldn't want to say particularly that I was oppressed and such, but, my experience of having my gender policed, or my experience of being shamed for my sexuality, etc., then also intersects with people listening to me because I'm 6'2", middle-aged, privately educated white man with a doctorate, and people just sort of like, I automatically assume that what I say is right, and all of these things, and really kind of having that, holding that kind of mirror up to yourself and going, wow, okay, I really do need to think about my own positionality in my work, in the way in which I write, in the way in which I speak, in the way in which I think about the work that I do with all of my clients, and particularly with the trans and non-binary ones who I support.
I like, Michael, that you say that I gave you permission to write from a mobile. I forced Michael to go there.
Okay. Potato.
I love that, like very, very like gentle, almost British refrain, like
no, we're going there. And I think as well, I don't want to speak for Skye, but I think also for Skye there was a big element, to think about their own identity and how, what is the impact in terms of putting yourself out there. And I think for a lot of people who are trans and non-binary, and the repeated experience that I'm hearing is, like, on the one hand, I want to represent my community, and I want to show people that you can be trans and a therapist, trans and a teacher, trans and a person who has difficulties or not, whatever it is. But also I want to just not be anything of these things, I don't want to be holding these labels constantly in front of my face. So I think that, it's about striking that balance with being authentic. This is what we needed to model for everyone,
And I think also, sorry to kind of keep jumping in, but I think that really kind of speaks to the title of the book. So the reason we called it Gender Affirming Therapy and what that sort of meant. And I think that for both Laura and I, we kind of went on a bit of a journey, if you like, but also, it was where we started with the title, but then we started to really try and bring that to life. And what does affirmative practice mean? What does it mean to do this kind of work in this way? And I suppose for both of us, there were the two things. One is knowledge, that it's incumbent on you to increase your knowledge in the area. So the example we always give is if you're working with eating disorders, for example, it's incumbent on you to read some books about eating disorders, to learn about the subject area. But secondly, and most importantly, to practice reflexivity in relation to that subject area. So to think about, what's my relationship with food? How do I feel about my body? what has been my experience of kind of dieting, of not liking the way that I look, of having the way that I look policed or commented on by other people, or feeling shame about different body parts and things. And so that I have this shared experience with the client. They're struggling with something that I also struggle with, or have struggled with, or have an experience of. And so for us, this kind of the part of, as Laura, I say, gave me permission, but also politely pushed me into it. But it's partly about kind of like showing your vulnerable bits in terms of, this is my experience, and when I reflect on my identity, this is what happens for me. And for us, those are the two things. That's what we mean by it, and that's what we think should kind of be the basis of it.
Oh, absolutely. I couldn't agree more. I feel like there are like 20 tangents I could go off on right now. I was like, also, I love that we were all brought up Catholic. So it's like, I feel like I could do episodes with everybody else who was brought up Catholic, just talking about gender in the Catholic Church. And I was like, I almost became a nun. I really wanted to be a priest, but that wasn't a thing, right? And then I was like...
I used to have a T-shirt that said "Recovering Catholic."
Oh, I love that. Oh my God, that is so good. And yeah, I did 2 years at the Gregoriana University. I was pretty serious about becoming a nun when I was big, brought up in Rome, and kind of, so I feel that. So there is a whole tangent there that maybe we won't go on around Catholicism this time, but who knows,
Another
maybe
podcast.
Another podcast episode, exactly. It could be gender and Catholicism. But I love a lot of what you said in terms of that, the reflexivity, right, from both of you. Because one of my pet peeves is always, often clients have seen a therapist for a long time, and then all of a sudden, they're exploring their gender, and it's like, oh, you need to go see somebody else, right? And I know that in some, in the UK it's a whole different system. But for example, here on Turtle Island in the so-called US where I live, right, it's like, that is not necessary. It's like, if we all have a gender identity, we should all be able, there are things like gender, sexuality, like we all have gender and sexuality in some way, shape, or form. It's part of the human experience. So I don't see it as a specialist, right, subject. And yet I think that any gender or sexuality that falls outside of cis heterosexuality is seen as a specialist population, or as the reserve of like a specialist, right? I was like, why? Like, we shouldn't refer people because of their gender and sexuality. And I've seen the harm of that too, right? Like the harm of like clients feeling like rejected, or feeling like, I'm such a freak that now I need to go see a specialist because of my gender, right? And it is painful, right? And I've also seen the impact even on like, clinicians who are 20, 30 years older than I am, in terms of sexuality, having internalized that sense of like having a criminalized sexuality, right? And that is trauma, actually, when our gender is policed, no matter what our identity is, right? We are being put in a box and squished, and like a part of us is being told it's unacceptable regardless, right, of our gender identity. And so I love how you approach it, because it really highlights we all need to like do our gender and sexuality work to work with clients. It should be an essential part. Does that make sense? Of our training? But it's not. Still, I don't think it is not a part of our training. So I love everything you just said about that. And I am curious about when you ask trans folks to like share, maybe like, I'm going to use some of your experiences in the book, or have conversation with some of your colleagues or clients. How did that go? How was that received? Because it can go, I think, a number of different ways. And I think sometimes people are like scared of asking, I don't want you to feel tokenized. I don't want you to feel othered. Like, but that I'm doing ballroom dance, and my studio was like, we want to ask you and your partner if you'd be in photos. But like the studio owner didn't want to offend you, and I thought it was fine. I was like, it's absolutely fine to ask. I was like, I do want to show. I was like, the studio is very trans and queer affirming, and of course, if you only have photos of people who look cis het, like people are not going to know that. But that kept me that nervousness, right, in approaching people who share different identities. And so I was wondering what that experience was like for you.
So there are some of the stories that I share in the different chapters, which is a bit of an amalgamation, and also the clients that I haven't seen perhaps in years. So I didn't have the opportunity to ask them directly. I simply ensured that, you know, their identity remained confidential. But the couple that I did ask, particularly one of them, he loved it. He loved it so much. I sent him the fragment. Then he came back because I gave him a pseudonym, and he is Mediterranean, but he is not Italian. And he loved the idea of seeing himself as Italian, and as, you know, so, and then he was signing the email back to me with the pseudonym I had given him. So he was really into it. Very, very funny guy. And then the rest of the interviews, actually, that was fully Skye's work, who was amazing at, you know, seeking people online and communicating with them and setting up the meetings. And I think perhaps the one interview or sets of interview that I was a little bit more anxious about was the interview with the parents of trans folk, because within that group and within any group of parents, you will find a variety of attitudes, right? So it was interesting for us to see who would come out, and also how does it feel to communicate, perhaps if you struggle with ideas around what it means to be trans, to a person who is themselves, you know, trans or non-binary. But what Skye related is that it was a lovely meeting, and they were all very keen, and we really wanted to ensure that everyone was comfortable with what had been published. So they received copies, they reviewed them, they came back, even, you know, they were so helpful, even like, oh, here, there's a little typo, make sure that it's corrected. So, you know, it was properly a collaboration with them.
Yeah, and I think certainly that although we haven't kind of particularly addressed it quite yet, but we wanted to carry that same thought on to the training platform that we've developed, Affirm, because I think that, you know, we've talked a lot about positionality. I think Laura and I are both very aware of our cisness, and this kind of idea of cisplaining transness to people and to trans people is like, it's abhorrent and we don't want to do it. But at the same time, we also recognize, you know, I first started working in the field 14 years ago. So I've worked on and off in it, but, you know, that we both have significant clinical hours. You know, we reckon probably together we maybe worked with or supported like 1,000 trans people. It's like, it's just like, it's lots of clinical experience, but we don't have those lived experiences. And so we want to kind of bring that in, and we certainly do that on the training platform as well. And that's where I have been involved in interviewing different folks, and then taking their stories and breaking them up into little snippets and clips that go into the training, so that you know, people who are watching or engaging with the training kind of have these voices.
Absolutely. I do want to talk about the training platform, and I also want to hold on to like one of the threads I was following is, Laura, when you said something about, and I'm going to paraphrase because I don't remember your exact words, but, you know, when you started working in the clinic, like you never met a trans person, right? And you really were like, what is my role, right? Am I just, for example, guiding trans women to understand what femininity is, right? What is it that I'm doing? And I think that is I love the way you put that, right? It's so like honest and authentic, because, you know, for myself, even as a trans person, I know I had to unlearn a lot of internalized cisgenderism, right? There are words we used to use, like when I started writing, you know, we used to use natal sex, you know, we used to say male-bodied, female-bodied, you know, in like, it was really other folks in the community, you know, who pulled me aside and were like, when you say male-bodied or female-bodied, you're like reinforcing this idea, right, that our gender is not real or authentic. And I was like, oh, that is a really good point. And I think, you know, that there is a real process of unlearning, right, and really uncoupling, we would say, in somatic experience, right? Those things like, oh, if I see somebody with a beard, it means they're a man, for example, right? And I know lots of lovely trans feminine folks who don't have dysphoria about their beautiful beards. And so that has been a process, right? Just because I'm trans myself doesn't mean that magically cisgenderism disappears from my mind. I mean, I wish. But in my experience, that's not how it works, right? And I've had really interesting encounters with clients, even because we have different ideas of gender, and often I'm like, well, I say to clients, my job is not to impose my ideas of gender on you. My job is just to ask you questions to help you think critically about the choices you want to make so that you make the best choices for yourself, right? And it's just like, and so I'm really curious about what did you find maybe, I mean, within the realm of what you feel comfortable disclosing in public, what did you find the most challenging concept to unlearn around gender, if that makes sense? What was one of the things that really was like, wow, this is a hard one for me? I know, like, I had my share as somebody who was brought up as a second wave feminist in terms of shedding, all that cisgenderism. But yeah, I'm curious about for you both.
I think that I'm not sure if it's unlearning, but yeah, the things that have been most interesting to me, and this is actually something I was talking with my husband about, and he put it even more beautifully than I could ever. And it's this idea of the assumption of sameness, right? Just because we share a human body, that doesn't mean anything, right? I don't know what, and you can see it, for example, on the perception of color. You put a green and a blue, and some people say, no, this is blue or this is green, right? And there's a gray area in between, metaphorically, not literally, where you cannot really tell the difference, right? Or pain. How do we evaluate pain? How do we evaluate these very intrinsic human and phenomenological experiences of our bodies and who we are in our environments? And I think that when it comes to gender diversity, that is the beauty of it. That you would be confronted with things that you don't quite understand, yet you have to rely on the other person, that actually, it sounds like they're sane and they know what they're talking about. And there's nothing really psychotic about their experience. It's different from my own. So who am I really to make a judgment? No, you are invalid. And then when we mix this with neurodiversity, and feeling your body differently with interoception, exteroception, all of these sensations that vary so greatly for people who are neurodiverse from people who are neurotypical, then it's even more. I think that now, starting as well, I sort of, as well, looking back the time that I've been in the field, how at the start when there were some non-binary folk who wanted to access top surgery without their nipples, this was like rare case study, right? You really need to think about it. There must be something wrong. All people have nipples. Why would you refuse this? And what I'm finding most recently is that there are a lot of neurodiverse people who have a hypersensitivity to their nipples, and it's making my life difficult. I walk around like this, pulling my shirt so that I don't feel this. So it's just inconvenient, And so again, it's about helping people feel comfortable in their own bodies. And it's about challenging whatever we feel normal is, right? Because we might be abnormal in another society, in another culture.
Yeah. I mean, absolutely endorse what Lara said. I suppose I was kind of thinking after you asked Alex of what the challenge has been for me. And I suppose something that I've noticed, that when I first started working in the field, you talked about different language that was used and so on. So in 2010, non-binary was not available. There was not really an idea. And I realized that basically my position in the clinic, and I wasn't assessing clients, I was doing psychotherapy with trans and non-binary folk to help them kind of either make sense of their decisions and their gender identity and explore it with them, or deal with challenges in living as a result of their gender identity, either how it affected their relationships with families and those kinds of things. But one thing I've become perhaps aware of is even though theoretically we talked about it a lot in my training, which is how to sit with uncertainty and be okay with it. We were kind of like, we're modeling uncertainty. We're okay with sitting with, but in fact, when you think about it gender-wise, the temptation to try and kind of move into a certainty, into a binary and just go, okay, well, you're completely and utterly clear. that you have a female gender identity, or you're kind of feminine or masculine or whatever, and that's clear. It never changes, and it's like, okay, everyone can kind of relax and we can go into our boxes. I think one of the things that continues to be challenging for me is to be okay with and to allow uncertainty and not knowing, and and even that the end point of therapy might be a comfortability with uncertainty rather than a certainty that kind of indicates that therapy's done now because we're all certain, and everything. So I suppose there's all sorts of tangents I could go off in that, but I suppose, yes, this kind of real pull towards gender norms and fitting in a box and being you're one of those, okay, so there we go, you're one of that, to be more relaxed or more okay with the stuff that we don't know.
Absolutely. And that's so much more in line with what we know even about how our brain works in terms of neuroplasticity. And so why would our gender identity necessarily stay like fixed in one place, And yeah, we have come a long way. I got my top surgery back in 2010, and it just was not a thing. I mean, yes, my surgeon talked about we can do a nipple grafting, but we don't have to. You can do surgical tattooing, right? But even a handful of years ago, it was, and I wasn't taking hormones, so we had to put that in the letter and why, and we didn't have non-binary language, right? And so it was definitely an interesting experience, and I was lucky to get it approved by insurance here, get it back. It was like, if you don't take testosterone before you have top surgery, that's not how it's done, right? Now that's not even a thing that I need to put in letters, by and large, if somebody is not on hormones and want to pursue other body modification through surgical intervention. It's not even a consideration pretty much anymore in most cases, at least in kind of my geographical context. So yeah, things have changed so much. And I love what you said about uncertainty. I often talk with clients about like, yeah, you can be 90% sure. It's okay. Like, and also you're probably going to have lots of different feelings, and I think that folks feel like I have to be certain, otherwise I'm a bad trans person. And then, conservative folks are going to use me as an example of like, see, people make choices and then they regret them. I was like, humans make choices they regret all the time. Most of the choices I've regretted have nothing to do with gender, personally. I was like, and, I also work with a lot of cis people who regret all sorts of things, right? But there is this pressure that we put on gender to be like, you have to be absolutely sure. And that really is just not human nature, right? We're as sure as can be, but there is that piece. Sometimes I even talk to clients like, like there is this concept of embodied cognition, right? Merleau-Ponty. Like, it's okay if you're not sure, if you're not going to know exactly how you feel on hormones until you're on hormones. That's the reality of it. You can make a best guess. You can, you can feel like, I think more or less this is what I want, but you're not going to know how it feels in your body, right? Until you've made that change. And so I love everything you're saying, because I think we need to change the way we approach trans folks, because there's so much pressure. And then you get this very cookie cutter stories, right? I remember when I started, especially in a gender identity clinic, when I started working with trans people, it was like, okay, you're giving me the spiel, right? I always felt like it was just really boring. Sometimes I would have to say to people, I'm like, that's great. I'm glad that's the official story. I'm not withholding the letter from you. I actually would like to have an authentic conversation to understand, right? And I don't know if that was ever your experience, but definitely, even 15 years ago, you would get this very like, this is what I need to do to go through the hoops. I need to perform my gender in a very cis-heteronormative way. Exactly.
I mean, I think one of the things that shocked me, I mean, the clinic that both Laura and I met in some years back, I think has, or certainly positions itself as the oldest, or one of the oldest gender clinics in the world. Charing Cross Hospital used to be. But I was stunned to find out that until reasonably recently, I'm going to say probably the 90s, the idea was that clinicians would only, well, they ostensibly saw far more trans women than they saw trans men.
Yeah.
And ostensibly they would only allow them to go forward for treatment if they believed they had a substantial chance of passing. And so the whole idea was that you had to kind of convince the doctor that you could pass for a cishet person or a cis person. And that's just, I mean, it's speechless with that. It's just like, it's horrific. And that attitude, certainly, I think, I don't know, Lara speak to that herself, but I think it was still kind of around I mean, it was not obviously policy in any way at all, but that sort of, that the scent of it kind of lingered on a bit, I think, and people would present for assessment a little bit in the kind of like, I've got to do the best job I can to convince you.
Yeah.
I absolutely see that, and I can almost not fully on to feeling that, because I guess it is a lot easier to validate and believe someone who matches your expectations, right? If you are a trans woman who is tremendously feminine, who has a very high-pitched voice, who loves to wear high heels and makeup, you're like, absolutely, you are a woman. However, if you happen to be a person who used to be a bodybuilder, who is very typically masculine in the body characteristics, then suddenly you go, are you sure? Are you sure? And this is something that every time I need to stop myself from having that automatic reaction. And I think that this is a lot as well part of what Michael and I are really wanting to work on when it comes to delivering these trainings through Affirm, is that reflexivity of the clinicians, in the same way that there is this whole beautiful and amazing movement around, challenging your own racism and not being blameful about it. Simply, you have grown up with these ideas about people who are different from you. This is the same basics that we need to apply to gender and to trans people, I'm always, I feel it's okay, but there's a little bit of me that feels sad every time a patient says, can I talk to you about my sexuality? Like, is it okay? Are you going to think that, like, the underlying speech there says, are you going to think I'm a sexual deviant because I have sexual feelings and I'm trans, And I see it time and time again, how this medicalization of trans identities and of gender diversity leads to sexual repression for trans folk, particularly for trans feminine people. And I really enjoy the part of the psychotherapeutic work that is about liberating, helping people to liberate themselves, to enjoy themselves, and to say, you have the right to enjoy. It's your body. Like, it's for you to take and to own and to use it in whichever way you feel it's best. And I think that's it. Like, there's a part of me that so looks forward to 30 years from now, looking back and saying, wasn't that fucked up? Sorry, I'm just going to swear.
No, you can swear.
Wasn't that fucked up about how police the lives of trans and non-binary people were? Because at the end of the day, there's an element about what are your core beliefs as an individual about the human rights of people. Do you think people have an ability to choose whether they can wear whatever clothes they want or any hair they want? Can they get fillers? Can they get Botox? Is that okay? Why, when we transgress that invisible line of feminizing or masculinizing someone, suddenly becomes a political issue? I cannot understand, and the variety of models, from the consent model to the more guided model or police, or in the UK, it really shapes the way in which we interact with the people that we are aiming to serve.
And I think, sorry, the point that just kind of like bubbles up and I need to talk about, but is the connection with your own work, Alex, with gender trauma, and I suppose to some extent the chapter in our own book which parallels that in terms of identity-based trauma, but this idea that we are all traumatized by gender role socialization, And so much of what Laura has just been talking about in terms of like our automatic thoughts about like what's an appropriate trans feminine person, what's an inappropriate trans feminine person, and so on. All of these stereotypes are kind of policed into us. And I think that's why I got into gender in the first place, because I had my masculinity policed as a gay man, and certainly in the era in which I grew up, and I suppose particularly maybe now as well. You can't really be a real man if you're gay, because gayness or homosexuality, whatever kind of language label you want to use, is the opposite of masculinity, because part of masculinity is defined by heterosexuality. So you can't really be a real man. You can sort of be a bit, and we see it within the communication communities of masculinity, that there are effeminate men, or we see it within, for example, even gay culture, you know, kind of like gym bunnies are kind of like the ones who were certainly in my youth of dating was like straight acting. Yeah. So if you were straight acting or could pass for straight, you had more social capital within the kind of gay community. And this pernicious constant trauma that we all kind of like playing out on each other for like how to be a real boy or a real girl or whatever. It's just,
Exactly.
Anyway.
It's so ubiquitous and kind of lingers, right? Even in the early 2000s, I remember presenting at the WPAF conference in Norway, and people are like, well, but you know, if a trans man really enjoys kind of penetrative sex because they're gay, are they really a trans man? Or are they just like, you know, some sort of confused woman? And as the very, you know, I'm very gay leaning, so to speak, trans masculine person, that was a lot to hear, right? And even in terms of gender identity and expression, right? The way I need to explain my gender expression, like if I'd been born a cis boy, I would have been a very effeminate queer cis boy, you know, for my mom to understand. I was like, I would not have been the quarterback of the football team in Glee. You know, I think I've used that example before on the episode. But just how that kind of people confusing gender for sexuality, you know, the pathologization of like trans women are attracted to women, even, you know, in our field. I don't even want to give that concept the favor of naming it actually right now. No. But like even the fact that the concept persists, that some people buy into it, and also that some young people then find it, right? Often I've had young trans feminine people are like, that's the first concept I came across, you know, and so how do I then feel like I'm, you know, it's a concept of pathology, right? And so like that lingering it's still very much like seeping in the field, you know, and it wasn't that long ago. Like, you know, even, you know, in my own lifetime, the university-based gender identity clinic I used to work at used to have panels, you know, before my time, but in the 80s, I think, still with like members of the public deciding if somebody was masculine or feminine enough that they could get access to hormone and surgery, or, you know, front office staff giving makeup lessons to trans feminine folks, you know. We're talking within my life, I know, and even within my own professional identity lifetime, I went from having to diagnose gender identity disorder, you know, to now we have the ICD-11 with gender incongruence, and that's in a relative, that's 2 decades. Right? It's a very, like, things have changed very quickly in some ways, but things are also swinging back, and there's all this trans panic, and I do want to talk about that, but I do want to talk about your platform. Tell me about the training platform that you put together, you know, which I think it's Affirm.LGBT, and of course we'll put that in the episode description. But yes, tell us about the training platform and what motivated you to put that together.
I think that, as you can see, Michael and I can speak for hours about this topic. So we needed a platform to speak about it.
Maybe we need to have a whole other episode about the platform. I'm okay with that. We just have to get schedules together somehow.
But yeah, I think that, you know, it's... I was always very frustrated with my teachers at university, with lectures being boring, with me saying, if you're going to tell it to me that way, I'm going to read it at home, you know, on my slippers and, you know, on my pajamas. There's no point in me going there. And I guess I think you learn more when people speak to you truthfully and from the heart and authentically. And I think that's what we wanted to do. So Michael and I sat down, and Michael used his amazing background in as a marketing consultant to sort of help us design what is it that we are and what we want to be. So Michael, what was the term we chose there?
The kind-hearted rebel was our so we were doing archetype work. So my background is in marketing and communication, so we were kind of doing brand development and so on, and saying we wanted to kind of like work from and speak from the heart, and we wanted to also be a bit rebellious, but within the context of counseling psychology or maybe clinical psychology, where we have to color between the lines and absolutely be very scientific. It's not that we didn't want to be scientific, but we also wanted to kind of like speak in a less dry tone, perhaps, and to be as warm, engaging, reflexive, all of the things that we've talked about in relation to the book, but kind of turn that into training. And as Laura says, both she and I have worked together on trainings before we started this. We delivered trainings together, we worked together, we just kind of vibe with each other, and we like and spark off each other, and we've got kind of good complementary skills, and as you said, we like the sound of our own voice a bit, and so the idea of doing some training together kind of was fun for us, and we've had a lot of fun over the last, I guess it must be 18 months now, building a lot of content.
So yeah, Michael has been traveling to Tenerife. There's been a lot of filming in my living room. My husband has been behind the scenes doing all the tech parts for it. And now we've come to the point where we're very, very proud to present a 5 hours comprehensive training for clinicians, any clinicians who might say, you know what, first of all, I might know enough about gender, but I've actually never been thinking much about my own gender identity, or this is the first trans client I have, or actually I don't have any trans client, but I find this very fascinating. So for anyone who would like to learn and not only hear us, but hear trans people speaking themselves about what it's like and what they struggle and what are the joys as well, then this is the sort of training we feel people should complete that we wish we had when we started in the field.
That is really wonderful. I mean, I wish that it wasn't needed, right? Because it was integrated in everybody's training. But given that it's not, like we said, it's really wonderful to have that kind of platform. And it sounds like you very much, just like in the book, it's not just folks talking from a clinical perspective, but it's also those lived experiences that I think it can be, so hard for folks to access. I often say to supervisees or trainees, like, read books, listen to podcasts, right? If you're in training and if you want to learn more about, trans folks or non-monogamous folks or queer folks, like read the stories, listen to the stories. Don't be your client. Be the first person, right?
Exactly.
Who tells you those stories because, find other avenues. But I love that there is an avenue that is more like, and here is something that merges kind of that scientific knowledge, like you said, Michael, with also lived experiences. Because, otherwise you can just read a paper in your PJs, like you said, Laura.
Sure.
And I think there is something to be said for kind of hitting people with their more emotive, like we're humans, right? We need to connect. Otherwise, it's kind of almost dehumanizing learning about other people just in numbers, right? Trans people are 10 times more likely to have suicidal ideation. Okay, but then you listen to a poem or like somebody who shares living with chronic suicidality, that's very different, right?
And I think also how we use statistics, your kind of stat there, Alex, just reminds me of a wonderful one that Laura shared, which is about relating to detransition, that you're more likely to become pregnant while using contraception than you are to detransition, and all of these kinds of, so sometimes using stats, but in a way that kind of disrupts a bit, or, but we want to be storytellers.
Exactly.
Yeah, there's also, did I send you, I think I sent you the screenshot, Michael. There was also like a recent article, I think it was in the Gay Times, saying that more people regret having children that regret the transition.
Yes.
I can believe that. Being parents is like really hard, you know, and it's really interesting. Also, I mean, best thing I've ever done, and also hardest thing I've ever done to parent children. And that's one thing, you know, like I've worked with clients who are trying to decide if they want children. That is a very, actually, like almost more heart wrenching process for me than people are exploring their gender or sexuality, because it's like, it's, you know, it just brings up a lot. And again, there's societal expectations, there's internalized expectations, there's a lot to, but we don't see that as like necessarily like, this is very specialist and set aside, right? So it's really interesting who gets to be viewed as like a human, and as therapists, we should be able to deal with those issues, and who gets to be viewed as like, this is a special case that right needs to go over there. I feel like we could talk about all those things for a long time. So you've got this wonderful online training program, you've got the book, and you're also, you know, folks who are very passionate about this access to healthcare. What's it like to do this work, or what do you feel like it's your role as cisgender therapist at the moment, with the increasing level of like backlash of like trans panic, transphobia, you know, like I would say almost everywhere. Definitely, you know, definitely here on Turtle Island in the so-called US. I know that Australia's got its own version, the UK has got its own version. So yeah, how do you see your role as cis therapists, authors, trainers in this moment, in this political moment?
Michael.
Sorry.
We're both kind of
just a light question.
Just a light question. I mean,
Just
it's a very, very live question, I think, for both of us. You know, I think I'll speak first of all from a personal perspective. I definitely am a kind of a voice within an overwhelmingly kind of cishet group of friends. Say, you know, I'll go to a dinner party with people who feel perfectly entitled, often cishet white men, to have opinions about things they know nothing about. And I'll just say, like, well, how many trans people have you ever met? Or how many books have you written on this subject? Or how many papers have you read? Or how many conferences have you been to about this? And yet you sit here with me at the dinner party telling me what the answer is. It's like, you know, sit down and listen, you know, don't kind of. So I feel kind of quite activist-ish, and certainly I advocate for my clients and for the communities and so on. That being said, it is a very difficult space to stick your head above the parapet and be an affirmative practitioner in a political environment, certainly in the UK, which is very transphobic. I would say the government is transphobic. There's more legislation which is apparently announced this week where they're like going to make it a sort of a statutory requirement for all new buildings to have gender-specific toilets, not gender-neutral toilets. And this whole kind of like, I mean, the bathroom panic thing is just nuts. And of course, it's a way of distracting, in my view, from the failure of the government to address all kinds of other things, and is part of obviously the kind of the culture wars. But to stand up for clients is and for to use my privilege as a cis person. I suppose I see that definitely as something that's part of being an ally. But it is also difficult, for example, to do that really publicly. I've been invited onto different news shows and things like that, often very right-wing news shows, and I've refused to go because I just don't want to be kind of like red meat to a transphobic news anchor to kind of like stir up things. And so I suppose, yeah, it's hard. I don't know. I'm maybe not answering this as clearly maybe but I feel very conflicted about it. I worry about being attacked. I mean, not physically attacked at all. But we know that within our discipline, I mean, I'm a counseling psychologist, Laura's a clinical psychologist, you know, tomato, tomato, but we're both within the British Psychological Society, and that there are gender critical practitioners and voices within that. Sorry, Laura, I'll let you speak a bit to this.
Yeah, it's challenging it's challenging to know what you want to do. You know, whether you want to, you know, really fight, whether it's a fight that is worth fighting, or whether you're just fueling the fire with your words. You know, so it's really a matter of measure. I think for me, what's most difficult is having to bring the political reality into my clinical work. And so, for example, as part of the assessments that I do for people who want to access hormones or surgery, we ask about fertility preservation, right? Would you like to have biological children one day? Is this something you're thinking? And most people, because they're so much looking forward to starting hormones, they're like, no, it's fine, I'll adopt. And I have to say, stop there. Do you think you might have the opportunity to adopt in future, or is this right going to be revoked? You know, we have, and I think currently in, I believe it's Hungary, there's been a regression of gay rights in terms of marriage. You know, so it can happen, and we are not in the best trajectory in the UK. And so to think that you have to think ahead because your rights are going to be revoked, it's really, really sad, and it feels paralyzing. And as someone who, like I said, being cishet, who has the privilege, enraged on behalf of my clients and on behalf of the communities, because I cannot, because it's absurd, simply absurd. But it's challenging as well because of this whole ideology that the gender critical movement is a valid one when racism isn't considered valid, when other forms of, I don't know, homophobia isn't considered valid, yet when we're talking about trans folk, it's kind of okay, you know.
It reminds me a bit of, it's two things that occur to me in what Laura was saying. One is, I would absolutely say that solidarity becomes more and more important. And Laura and I kind of have worked with and connected with a bunch of organizations. We recently worked with Transgender Europe to deliver some training for mental health people and psychiatrists, psychologists in Slovakia, where there are no gender services. And we know that clinicians there are being targeted by individuals who say that their work is sinful and wrong and so on, and how we can have solidarity for and with one another to sort of like, so we don't feel like we're on our own. And I guess I can't now remember what my second point was. It was followed from what Laura was about to say. I've kind of lost my thread in that kind of question around solidarity, but also that kind of recognition that rights what is being given can be taken away.
Yeah, absolutely. And I love what you both said, and I know we're kind of coming up to time, but I think it's so important to, and often it's like, yes, it starts maybe with trans people, but then it's like, well, which queer people are acceptable, and then no queer people are acceptable, like, and actually then we see that, actually, like, this is racism even a thing, you know, critical race theory that we're seeing on Turtle Island. We know that it's never just about one group of people when we're trying to police folks, right? And so and it's tricky, like you said, Michael, and Laura as well. It's like, how do you discern which fights to step up about, which fights to, like, you know, amplify, which fights are just not even worth it because it's just cannon fodder for right-wing media, right, and or conservative media. It's not easy to do the work you do in this current political climate, for sure.
And I'm struck also by your, it just reminds me of the very kind foreword that you wrote to our book, which was written in the aftermath of the Pulse nightclub shooting in the States, but also my own kind of experience of growing up as a gay man in what was then Rhodesia, then Zimbabwe, the very kind of heteronormative macho masculinity where gay men were seen as a threat to children, and that very much you can't have gay men being around kids because they are ultimately going to recruit them or sexually assault them. And the same tropes are being rolled out, particularly for trans women. Trans masculinity is less problematized and we can have a whole thing around the patriarchy and masculinity and all those kinds of stuff. But it seems that trans women are being particularly, or trans femininity is being particularly attacked in the same way or similar ways to the way that gay men have been, and maybe perhaps continue to be in different ways attacked as some kind of threat.
Absolutely. It's all part of that biological determinism, right? If you have a penis in some way or ever had one, you're a threat. But, you have a vulva, you couldn't possibly be a threat. We'll just infantilize you and just not pay any attention to you, basically, which is like, right, because you couldn't possibly be a threat, right? It's just always goes back to that biological determinism, which ultimately then invalidates trans folks' identity. But yeah, the tactics are the same. And those of us who are old enough were like, hang on a minute, we've seen this discourse around grooming, right? This is not our first kind of rodeo. And it's, yes, absolutely, and as a parent, I've had people when my oldest was little, like trying to stop me from going into the bathroom with her, even though she wanted me to go to support as a neurodivergent kid. And like, and depending, if my gender is read ambiguously, like, right, what's happening is that you're a child, what's going on, right? So it's like, yes, if you're a trans man who passes, you might, but if you're like a gay trans man who's a parent, then it's a whole different ballgame, because then you're falling more into that, like, what happens to queer masculinity around kids, right? I remember having to say to her when she was a young teen, like, please don't look like I've kidnapped you. This is why, conversations that queer parents have to have with their kids that non-queer parents don't need to have, right? This is complicated enough with all of us have different last names, and me looking like this was like, let's not make it harder and have to talk to some social workers about what's happening, I'm not like trafficking you. I'm your parent trying to travel with a very cantankerous teenager, and of course we gotta laugh, but it's like, like, right, I shouldn't have had to have this conversation with my kid, but it's all the same roots, right? Who's the danger and who's not, and how do we maintain this like colonial cis heteronormative state? Oh, we could go on. So we'll have to do another episode to talk about all the things, because I also know it's like afternoon for you, and it's like we're going over a little bit our allocated time. So the question I always ask at the end of interviews is there anything that we haven't talked about that you were really hoping that we would talk about? And if there isn't, that's okay. But I always ask that question just to make sure.
Such a therapeutic approach to the podcast. Alex is showing. There's nothing else from my end. Thank you for the question.
No, absolutely. I mean, there's so many things, as you say, that and tangents and different places we could go. Your sharing of your story about parenting reminds me of that. I think it's a YouTube channel, or certainly a meme, but like driving while black. I sort of think parenting while queer. It's a whole other, it's a whole kind of other thing. But yeah, I mean, nothing big has been left out from my side. But I've had an absolute blast. I've really enjoyed the conversation.
Yeah, likewise. I'm looking forward to that Catholicism and gender episode that maybe we'll do at some point. And if people, all of those links will also be in the episode description. But if people wanted to get hold of your lovely book, which if you're watching this on YouTube, you can see what a pretty cover it is, Gender Affirming Therapy, a guide to what transgender and non-binary clients can teach us. Where can they find your book? Where they can find you and your learning platform? Just all the links, share them away.
It's the only other thing as well is that it is a beautiful cover, because Fox Fisher drew the cover.
That's right.
So we're very, very happy that collaborated with us.
I love it. I love all 3 copies at the once. Fox's beautiful cover. There you go.
Excellent.
Yeah, so you can find the book, I think, wherever you get books. So order it, ask your library to carry it. And then the platform is affirm.lgbt, right? And is there anywhere else that people should follow you, any social media that people should follow, or anything else that you want to share?
So I'm the social media manager here.
So
we have a LinkedIn account to the name of affirm.lgbt, but also I have my own profile, so you can follow me, Laura Scarronet Bonhom. If you can spell that, you can try.
it will be in the episode description.
Okay.
Michael, how about you? Any additional social media platforms for you?
I'm a little bit of a kind of social media phobe. I know that we shouldn't be, and that we should be more present. But when I spoke earlier about complementary skills, this is one of them where Laura is able to kind of hold that. And it's an area and a thing that I feel quite anxious about, perhaps betraying my age. But yes, Laura kind of holds that for both of us. So,
if you want to send messages for Michael, I'll pass them on.
Great. So contact Laura. She'll get you.
My social media secretary.
Exactly.
Oh, I feel you. Social media is getting intense. I'm in my 50s, and even as an early adopter of technology and as a social media enthusiast, it's a lot to keep up with. Don't ask me about TikTok. I'm like, I kind of get it, but, and Tumblr just passed me by, I'm still on LiveJournal, so it's all good. Well, this has been an absolute delight. Thank you both so much for making time for this. And thank you for creating this beautiful book and the training platform. Really looking forward to checking that out and recommending it to folks. And wonderful Gender Stories listeners, thank you as ever for listening. I hope that this episode kind of gave you some inspiration to explore what is it that I need to unlearn about gender to make my life and maybe my loved one's life more expansive and more easeful. And until next time, take care.